So we're going back old school. I'm in my old room. I've got the door wide open. We'll see if Aspen comes in. She's kind of sleeping right now because she's recovering from surgery. As I've hinted from this title, my dog just had a dental. We had 2 teeth extracted from my dog. It's a whole story, but I thought that this would be a good educational video because I think a lot of dogs have to go through this, and a lot of people don't know what to expect. Thankfully, I have experience in the veterinary industry and I knew mostly what was going to happen, but there's definitely not a lot of videos out there that explain it. So let's get right into it. I'm going to cover absolutely everything that I can. I'm going to make it as educational as I possibly can. I might leave some stuff out, but I'm going to try and cover everything that kind of comes to my brain. So first things first, let's talk about how you can make sure that your dog's teeth are healthy. I'll tell you the story of how I found my dog's broken teeth. So I've been gone for about 8 months. As some of you know that follow my YouTube channel, I'm a PhD student and I do research in the Arctic. So I was gone for 8 months and I came home. And normally when I was here, I would brush my dog Aspen's teeth. And so when I first got home, she really needed a groom, and I always brush her teeth in the bathtub when I'm bathing her. And I looked and I saw a broken tooth. She had a slab fracture. I'm actually going to insert a picture right now, or actually I have a video of it, so I'm going to put a video of it right now. Alright, so here we've got Aspen, and it's on her right side here. It's the upper 4th premolar, so that's the canine in a dog. Then you've got 1, 2, 3, and then the big huge tooth is the 4th premolar right here. Aspen, let me see if I can get it focused a bit better. Yeah, so there you go. You can see the slab fracture right there. You see that crack right there? Yeah, that's a slab fracture. And as you can see, a slab fracture is basically like, it's almost like rock slabs. When you hit a rock and this like slab falls off of it. It's the same thing with a tooth. When a dog is chewing really hard on an object, it can fracture the part of the tooth and it creates this like slab on the side. So you would have seen this little line. It's like a fracture line along her big huge premolar. It's called the carnassial tooth, or carnasial. Some people say one or the other. And I saw that when I was brushing her teeth and I thought, oh no, oh my goodness, she's fractured her tooth. So we took her into the vet, and most definitely she had fractured her tooth. So we knew that that tooth had to come out. Now, for anyone that's wondering whether or not their dog's tooth is broken or if they have to have a tooth extracted, one of the really good ways to monitor your dog's teeth is to brush them regularly, at least once a week. So I would highly recommend that, and you're probably going to be able to catch something that happens very quickly. It's pretty obvious in other teeth when they're broken. A canine tooth, you'll see this like chunk of it missing. It's very obvious, but you do have to kind of go in the back of their mouth, lift up their gums, take a look at those back teeth to really monitor them. Alright, so let's say that you're monitoring your dog's teeth and you find something that you really think might be a broken tooth. The first step that you want to take is to take a look online and find vet clinics that have free dental exams. So a lot of vet clinics will have this like free dental examination that they will do on your dog. It's not a full body exam. Like, they will not take a look at your entire dog. They will literally just bring your dog to the back, look inside of their mouth, and evaluate whether or not there is a broken tooth. So I would highly recommend that you take a look at which vet clinics do offer that, because that's just a wonderful service that you can take advantage of. And then the thing that you want to ask for during these meetings is a cost estimate of the procedure. So this is going to give you a breakdown, cost by cost, of every single thing that they're going to do to your dog. So of course the next step is to make sure that you don't just go to one vet clinic, that you go to multiple vet clinics and kind of evaluate and cross-examine each estimate. Make sure that you're happy with the estimate that you do get. One thing that I really do want to emphasize in this video is that cheapest is not best. Okay, you guys? Like, make sure that you're comparing apples to apples and oranges to oranges. Make sure that the estimates that you're looking at, you really do figure out what is offered in the ones that are more expensive that make them maybe better than the ones that are the cheapest that you find. So one thing that I'm going to do in this video is I am going to show you guys the estimates that I got for my dog. I went to 2 vet clinics, and honestly, like, the reason why I stopped is because I found a vet clinic that I was really happy with, but I would have kept on going if I wasn't completely sure. So before I show you the cost estimates that I got, just a quick disclaimer, this is not an indication of how much it's going to cost you for your dog. Every single tooth can be a different story. If you have a canine that's broken, it's going to be completely different from the estimate that I got in my dog. Every single vet clinic too, you're going to see varies significantly in cost. So the clinics that are in your area may have very different costs compared to my area. But I think this is a really useful tool so that you know how different vet clinics can be, because, like, we're talking about hundreds and hundreds of dollars difference in price estimates. Alright, you guys, so I've got my 2 estimates right here. I've blocked out their names because I don't want the vet clinic's names to be on my YouTube channel, but every estimate is going to be different, and you really do want to compare what each one has, maybe what's missing from one or the other. This is the first estimate that we got, and the total for the 4th premolar tooth extraction was $1,357, but the actual total could vary up to $3,000. So on this estimate, we've got all of the important stuff: blood work to make sure that livers and kidney are functioning properly, anesthesia, IV fluids, teeth cleaning, dental x-rays, the extraction itself, pain management, and she's got a antibiotic injection there as well. Now we move on to the second estimate that I got. This is for the exact same tooth extraction. This clinic charges around $983.33 for the 1 tooth extraction. They have most of the same stuff. They just kind of included the dental level 1 here is like everything that's needed for a dental cleaning. So that's all of the anesthesia, the fluids, and all of that kind of stuff. We've got the pre-anesthetic profile, which is the blood work, all of the dental x-rays. This clinic wanted to do a coagulation profile to make sure the dog can coagulate its blood properly. Anesthetic maintenance, the extractions, the x-rays, and pain management there too. So this is for the exact same tooth. The first thing that you want to do is to take a look at these estimates and see which one is missing the other things that the other one would charge for. So typically look at the most expensive one and see what might be missing in the cheaper one from the most expensive one. And we can see on this one that there is a charge for an antibiotic injection. So this vet wanted to do antibiotics following the tooth extraction. They also do want to do a dental block, which is like a nerve block, to make sure that the nerve isn't responding anymore when the tooth is pulled out. So that's the main 2 differences on this estimate versus this one. This estimate does not have a antibiotic injection, and it also doesn't have a dental block. So when I talked to the vet at this clinic, he did not believe that there should be the use of antibiotics without a need for antibiotics. So of course, as an infectious disease person myself, I understand that we do not want to use antibiotics in a situation where it's not called for, because you can create bacteria that are antibiotic resistant if you continuously use antibiotics. So if it's not necessary, I'm perfectly fine with that. The next thing is that the nerve block was not included in this price estimate. And I did ask, the dogs at this clinic are put on IV pain management immediately during the surgery and following the surgery, So they are on pain management. It's just that their method of managing pain is different than this clinic's method of managing pain. So those are the two main differences. Now, I knew that I was okay with no antibiotic injection. I knew that there was sufficient pain management. We've got tramadol right here. And I knew that she was going to be on IV pain management while the procedure was happening and after the procedure was done. So I was perfectly fine with what was missing in this estimate versus this estimate. All right, so now that you know what's missing from one versus the other, you want to take a look at, I would recommend 3 things that are going to be on every single dental estimate. You want to take a look at the x-rays, how much that costs, the dental extraction time, how much that costs, as well as any blood work and how much that costs. So let's take a look at the blood work here on the most expensive estimate. Oh, I switched them around here. This is the most expensive estimate. So we've got the blood work in-house is $101 versus this clinic here. The blood work, the pre-anesthetic profile is $74. That is a $25, $26-ish savings. Now, take a look at the most expensive clinic's cost for dental x-rays. We've got the first dental x-ray is $38 and any additional x-ray is $25 versus this clinic here. Their dental x-ray, the first one is $28 and any additional is $18. So remember the last clinic was $38 and $25. So that right there is another pretty good savings. Then you want to take a look at the dental extraction costs here. So the extraction, there you've got it, extract tooth per 10 minutes. That is the cost that the vet charges you for their surgical time. So the time that it takes them to actually take out the tooth. And this clinic thought that it was going to take about 30 minutes, so that's why there's a 3 right there. So 3 times 10 is 30 minutes. And it's going to cost $387. So you divide $387, let's round that up to $390 by 3, and that's going to be around $130 per 10 minutes. Now, this clinic right here, they have the exact same thing, dental extractions per 10 minutes. That's the vet's time. That vet thought it was only going to take them 20 minutes to do. And their total for the 20 minutes is $142. So that is around $71 per 10 minutes versus this vet right here that charges $130 per 10 minutes. So both of these vets are general practitioners. Both of them graduated with exactly the same qualifications. This vet is not a specialist, and so clearly this vet charges a lot less for their time under surgery. Those are the 3 things that you want to take a look at on a dental estimate. They're going to be on almost every single dental extraction estimate. Hi, honey. Are you poking your head in? All right. So you've gone over the estimates and you figured out what clinic you're going to go to. Obviously, the clinic I decided to go to was the one that was a bit cheaper than the most expensive clinic, just because it was a very different amount of money that the one vet was charging for time under surgery versus the other vet. And I think they did a pretty good job. Aspen just kind of got out of surgery. I think this is her 3rd day that she's been out of surgery. Hi, honey. Hi, honey. Can you want to give kisses for you? Oh, thank you, sweetie. So just take a look at the estimates that you do get and make a decision on what you think is best for your dog. Now, the thing to expect when you go in is that they're probably not going to be able to have any food the morning of surgery. And they're probably going to give you a cutoff time for the evening where the dog can eat, and then they can't have any food after that. And that's just because they're going to be going under anesthetic. The thing to expect with tooth extractions is that they actually do section off the teeth. So when your dog goes under they're going to take a look at the teeth, make sure that there's nothing that you've missed, because in all honesty, it's a lot easier to find things when the dog is under anesthetic versus when a dog is awake and you're like trying to juggle lifting up the gum flaps and all of that. So once your dog is under and they figure out what they need to do, they're going to be extracting the teeth, and they actually section the teeth off based off of roots. So a canine tooth only has one root, and so that tooth is going to be pulled out whole. They don't have to do any sectioning. But with my dog, her premolar, the carnassial tooth, was the one that needed to come out, and that is a 3-rooted tooth. So I've got an example right here for you. And actually I should preface this by saying that we actually found out that my dog had both sides fractured, so she wound up having to get both of her teeth taken out, her carnassial teeth, her 4th premolars taken out. So what they wind up doing is they section off each part of the tooth with the root that corresponds to it. So this is actually her one tooth on one side and the other tooth on the other side, and because it's a 3-rooted tooth, they have to split the tooth into 3 parts, and they pull each root out separately. So that's kind of what's going to happen if you have a molar or a premolar that has multiple roots associated with the tooth. I just asked for them back because I'm interested in this kind of stuff, and I think it's a really good visual. So that's kind of what happened to Aspen's teeth right there. So this gives a good example too of what happens when the dog has the tooth extracted. So this is an example I showed you in video what that one tooth looked like. The slab fracture is right there. You can see kind of the crack, and she's under anesthetic, so that's why she's got a tube going into her trachea right there. That's all of the plaque that was kind of around her teeth. She really didn't have that much plaque around her teeth. She's only 3 years old. But this is after the extraction. So they do put a few stitches in. That tooth is now gone, and all of her teeth are cleaned. Now what we found out is that on the other side, she had the same thing, except for the fact that that slab had already chipped off. So you can see right here that there's a bit of red, and this whole part right here used to be a tooth, and there's like a little slab that got fractured off right there. So this tooth had to be taken out too. That's a better image of the stitches that they put in. And so that's what your dog's mouth looks like after the tooth is extracted. Alright, so now it's time to pick up your dog. And your dog is probably going to be very groggy. It's going to take them a long time to get through the anesthesia that's in their system. They're going to be sedated, they're not going to be themselves, and also if you're on any type of pain management, especially opioids, the dog really isn't going to be themselves until they're off all of their pain meds. So Aspen just had her last pill this morning, so hopefully she's going to be completely back to herself by this evening. What you want to make sure you have when you pick up your dog is your take-home pain meds. That's the most important thing. If any of you guys have had teeth extracted, you know that it is not a walk in the park. It's quite painful, and you want to make sure that you've got your pain meds. So you go to the clinic, you pick up your dog's going to be out of it, it's totally normal. Get your pain meds and make sure that you stick to a schedule. So when it says every 12 hours for pain meds, make sure you do it every 12 hours. With my dog, I was giving it to her at 5 o'clock with her food in the evening. That means I woke up at 5 a.m. to give her her pain meds. If you've ever recovered from surgery, you know that it's very important to keep on a very strict schedule with pain meds, because if you miss even an hour in that window, it can really affect the amount of pain that you feel. So stick to a very strict schedule, make sure that they get their pain meds. Also, you're probably going to be recommended to go on wet food for a certain amount of days depending on the vet. So Aspen, she's on wet food for 7 days after surgery, so she's not allowed any hard foods at all for 7 days, and she's going to be able to then slowly transition to harder and harder foods after that. Okay, so after all of that, I know it's a lot of information, but I really wanted to stuff as much like info and education as possible into this one video. I hope you are able to make a well-informed decision and just feel very confident about making a decision when it comes to dental extractions and having to get your dog's teeth taken out. It is not fun, but I mean, it's something that's completely necessary. The reason why you do want to take out a tooth if it is broken is because it is a highway for bacteria to enter into the tooth. As you saw with my dog's teeth, the roots extend way into the bone of the maxilla or of the mandible, and you don't want any bacteria getting in there. It can cause osteomyelitis, it can cause infections in the bone. It's not good. So it's really important to take out teeth if they are broken. But I hope that this has given you a lot to think about, and I hope you feel that if you are ever in the situation that you are well prepared to deal with it. So I'll see you guys in another video. Aspen's right here. Do you want to say goodbye? Happy? She's still kind of sedated. A little sedated, but she's a good girl. There you are, honey. You want to say bye? Not really. You're still a little drugged up? Okay. Alright, see you guys later.